Welcome to an online event brought to you by Parkinson's Community Los Angeles and Abbott. Today, we're talking about the role of nutrition and deep brain stimulation surgery in Parkinson's treatment. I'm Judy Yaris, Vice President of PCLA. For those of you who don't know us, we're a Los Angeles-based nonprofit that supports families living with Parkinson's disease through all of our free online education events, support groups, our information and referral program, and so much more. All of PCLA's programs are made possible by our generous sponsors like Abbott and through donations from the Parkinson's community. If you appreciate the work we do and support we offer, I hope you'll consider making a donation to our website at www.pcla.org. Thank you. Just a few notes before we get started. We're recording today's event for our YouTube channel. And if you do not want to be visible in the recording, please turn your video off. You will also receive a link to view the recording after the event. Please stay muted to keep background noise at a minimum. And we will have time for questions at the end. You can submit them into the chat at any time during the presentation. If typing is difficult for you, I will ask for spoken questions from the audience at the end. Please keep your questions on topic. We'll try to answer other questions if there's extra time at the end. So please join me today in welcoming our speaker, Dr. Zenos Mason. He is a movement disorders neurologist and assistant professor of neurological surgery and neurology at the University of Southern California. He came to Southern California from Boston, where he completed his medical degree at Harvard Medical School and his neurology residency at Brigham and Women's Hospital and Massachusetts General Hospital. Dr. Mason's clinical and research interests are in the use and development of deep brain stimulation as a treatment for movement disorders. He lives in West Hollywood with his husband Daniel and their dog Sadie, and is a musician in the Los Angeles Doctor Symphony Orchestra. We are pleased to say that Dr. Mason has recently joined the PCLA team as a member of our Volunteer Medical Advisory Board. And I am very thrilled that I can bring you this programming today. So without further ado, Dr. Mason.
Thank you, Judy, very much for the introduction. And good morning, everybody. It's really nice to be here. It's always an honor to be asked to speak, and especially with PCLA because, good morning. I know what great work they're doing and we're doing as a member of the team. I can say that now for the community. So first of all, if you have questions, feel free to put them into the chat at any time. I would like to leave a lot of time at the end for questions, but just in case, if you have any burning questions, do put them in the chat. And this talk was and is about deep brain stimulation and nutrition, although it seems that, Mary, I just saw your question, and so I'll try to address that. It seems that there are always a lot of talks on deep brain stimulation and not enough on nutrition. So I really do want to focus on that. So let's get started. First of all, I'm not a nutritionist. I'm not a dietitian. And so I really encourage everybody to speak with one if you have access to one. Talk to your neurologist, talk to your movement disorder specialist about maybe being referred to a nutritionist or a dietitian. They can be extremely useful. Second, this talk is sponsored by Abbott, and I always appreciate their involvement in patient care and community outreach. At the same time, they haven't influenced any content of this talk at all. They have provided some slides that I've modified, but otherwise have had no role. And I also have no conflicts of interest, either financial or otherwise related to the content of this talk. And that's always just something to be aware of and consider when somebody's presenting information from the medical field. So we'll start with basics of nutrition. Some of this is going to be very basic. Other points will seem a little more advanced. Second, we'll get into the importance of diet for Parkinson's disease in general, and then talk about 4 or 5 ways that diet is important for people with Parkinson's disease. I'd like to introduce a couple of clinical trials that are using principles of nutrition and trying to modify aspects of the metabolic pathway or nutritional or pathways that are related to nutrition. And then talk about some specific supplements. And Mary, I'll try to talk about aspartame and phenylalanine at that time. And then just give a very brief introduction to deep brain stimulation. And there were a couple of questions that Sarah sent me yesterday that we can cover specifically related to deep brain stimulation. So getting into the basics of nutrition. First of all, I'd like to introduce the concepts of macronutrients and micronutrients, which you have probably heard. But starting with macronutrients, these are chemicals, compounds that your body uses for energy. And so because of that, you need a lot of them. And every food that you consume is basically comprised of these 3 macronutrients and other things that your body doesn't use in such high quantities. But the macronutrients are fats, carbohydrates, and proteins. So fats from vegetable oils, animal fats, these are the long-term storage molecules for the body. And sometimes fats can be broken down into ketones, which are used specifically by the brain for energy. And usually that occurs in a state of calorie deficit or starvation, where the body is using a fat that it's stored, breaking that fat down, and part of the fat becomes chemical known as a ketone. The ketone can then travel to the brain and be used directly for energy. Carbohydrates are much more commonly the source of immediate energy for the body. These are things like rice, breads, and pastas, fruit sugars. They're also present in vegetables in various quantities, table sugar, syrups. It's the short-term energy storage as well. So specifically by the liver, carbohydrates are stored in a big chain, which is called glycogen. And the liver stores that glycogen for immediate use in states of sudden activity level. So as a fight or flight mechanism, the liver releases its glycogen stores so the body can use that energy from carbohydrates. The third category is proteins. And of course, proteins are found in fish, meats, including poultry, and then vegetable sources like legumes. Rarely, proteins can be used as an energy source, and muscle can be broken down for energy if the body needs to use it. But the much more important role of protein in the body is as the cellular building block. So it is the compound that your body uses to produce basically everything. Every operation of your cell or of the cells in your bodies, including your brain cells and every other cell, is conducted by proteins. The muscles are built of proteins, but so is the skin, and really every important tissue in your body. So you need proteins, you need to take them in from external sources, and your body does produce them on its own as well. And then the fourth source of energy, which people don't usually think about, raise the volume for the speaker. Let me speak a little closer to the computer. Does this help? Can everyone hear me well? Okay, good, thanks, Judy. So the fourth macronutrient is alcohol. And people don't think of it as an important nutrient for the body. It doesn't really serve any purpose but to be broken down and provide energy when it's taken in. But it does have a caloric content, meaning when you drink, there's a certain number of calories in anything that you do drink. It's also an intoxicant, so you can't take it in for all of your calories, but it does need to factor into your calculations, so to speak, about how much energy and how many calories you're taking in per day. So that's macronutrients. Micronutrients are chemicals that your body uses in very small quantities, but they're of extreme importance. So this includes vitamins, vitamin A, B, C, D, E, K. These have all different roles, whether it's for B vitamins in the production of energy, the facilitation of metabolism, or vitamin C as a strong antioxidant to prevent tissue damage, or vitamin D to allow the body to absorb calcium, have strong bones. They all have important roles in metabolism. And minerals, which include potassium, sodium, magnesium, are important in the operation of all cells throughout the body, but especially cells that are electrically active, so to speak. So nerve cells, muscle cells use electricity in order to fire in a coordinated fashion. And so does the heart. So these minerals are especially important for operation of brain cells and sort of electrically, so to speak, active cells. The second important concept is that of energy balance. And to some of you, this will seem quite simple, and others, these might be new concepts. So I'll walk through it. The idea is that your energy is always in your body is always in a state of either positive or negative energy balance. So when you're in a state of positive energy balance, when you're taking in more calories than your body is expending, your body will store those calories, usually in the form of fat. And if it's a day where you don't eat much, or a period where you don't eat much, or in states of starvation, your body is in a negative energy balance. You're taking in fewer calories than you're expending. And in that state, you're going to lose weight. So weight loss and weight gain really is, in some ways, although there are things over top of this simple concept, like hormonal balances and influences of genetics. But on a very simple level, weight gain and weight loss is determined by the energy balance, which is calories in and calories out. So how do you determine how many calories you're actually going to need? That is based on two factors. And the first of those is the idea of basal metabolic rate. Basal meaning base, so basis. This is the amount of energy your body uses throughout the day, only for life-sustaining processes. So this is the energy that your cells use to produce proteins that are required for life. Some cells may be dividing, the energy used for that division. The energy used to power your heart and your brain in order to pump blood around your body and power your respiration. This is the basal metabolic rate. And in most people, that's between 1,600 and 1,800 calories per day. The extra calories that you require to maintain a stable, neutral energy balance is based on your activity level. So for somebody who is largely sedentary, doing a lot of sitting or laying throughout the day, this might be as few as 200 calories just to sustain basic walking throughout the house, or movements of the limb to feed yourself. For somebody who's a little more active, and for somebody who's working, this would be like a teacher or a grocery worker who's on their feet walking throughout the day, that might be 400 calories. And for somebody very active, it could be 600 or more calories. So what that means is that most people require around 1,700 plus around 400 calories. It varies based on weight and age and sex, but around 2,200 calories a day. So if you want to calculate your own basal metabolic rate and total caloric needs, there's a number of websites online that you can use to do this. They all use slightly different formulas. And the one that I like most is calculator.net/calorie-calculator.html. You can Google calorie calculator or basal metabolic rate. So specifically drilling down, now that we have these basic concepts into the importance of diet for Parkinson's disease, there are 5 aspects I'd like to talk about. One is maintaining a healthy weight to facilitate movement and exercise. Another is fighting constipation, reducing swallowing trouble, and enjoying mealtime. Medication absorption, and there was one question that we received in advance of the talk on medication absorption, and possibly in slowing the progression of Parkinson's disease. So we'll start with maintaining a healthy weight. Parkinson's disease leads to an increase in basal metabolic rate, so the amount of energy that your body uses to sustain itself, but it also increases the amount of energy that your body uses throughout the day because of movement. And so there are extra movements in Parkinson's disease. The most obvious is tremor. That does consume calories because your muscles are contracting, constricting and contracting to cause the tremor. It's a small number of calories, but it does increase. And dyskinesia, excess movements related to medications, which are those more dancing, flowing movements that some people experience in their head or torso or arm. It can be on arms and legs as well. All of that will consume extra calories. And this might only be 50 calories for some people. It might be as many as 100 or 200 for others. But throughout the week, if you don't consume those extra calories, that really does add up, and it can lead to significant weight loss. And significant weight loss over time will lower your energy. It'll make it more difficult for you to exercise. It will also, as you're consuming fats, make you more susceptible to fracture with a fall. because there's less padding. And it can also change the way that you're absorbing calcium and lead to weakening of your bones. So what we really encourage is for people to maintain a stable weight, despite that added requirement of calories from Parkinson's disease. So what does that mean? What does that require of you? It means you need to take in extra calories. And the easiest way to do that is through fat. The reason is that per gram, per weight, fats contain the highest number of calories. And I always forget this no matter how many times I write it down, but I believe it's 9 calories per gram for fats versus 5 calories per gram for protein and carbohydrates. So that just it's very straightforward. If you consume the same weight of fat, you're consuming more calories. And so fats are the easiest way to get extra calories into your diet. And there's 3 ways I usually suggest doing this. One is by consuming vegetable oils and adding vegetable oils to food. And if somebody's health and heart health are especially good, then I might even recommend adding butter. But adding a really healthy fat is the easiest way to make sure that you maintain good heart health and good cardiovascular health and protect yourself from stroke and heart disease while adding those calories. So you can consume vegetable oil on its own. You can add that to foods in small quantities, and even adding a tablespoon to your dinner, just adding an extra tablespoon of oil to a stew, or putting it on some vegetables or adding it to potatoes can get you an extra 100 calories just with a tablespoon or so of oil. You can also consume those calories in nuts, and avocados are a great source of healthy vegetable oils. And another source of relatively healthy fat is dairy. There is some debate in the field about the health benefits of dairy. But if you're choosing between a reduced fat dairy, either milk or yogurt, and a full fat, and you're trying to maintain a healthy weight, just go for the full fat. Because that little bit of difference can provide you the extra 50 or 75 calories that you need. And for the most part, those fats, unless you consume them in extremely high quantities, are healthy and safe. So of course, the other side of this, and let me just check the time here. The other side of this is to prevent yourself from gaining too much weight. And I do have to be sensitive to the idea that has really appropriately gained traction of fat shaming and the sort of social consequences of placing a moral value on gaining weight. So I want to avoid doing that. And I will say that although some conditions are more common in people who carry around more weight, things like diabetes or high blood pressure or hyperlipidemia, and as physicians, we've been trained to think of those things going together. Not everybody that's fat or overweight, depending on the word that you'd like to use or identify with, is unhealthy. So I just want to appreciate that and say that very practically speaking, the reason that we want to encourage people to drop a little bit of weight if they're carrying around extra weight or maintain a good weight is because it does, for many people, make it more difficult to exercise. So as we age, if we're carrying around more weight, it will make us more susceptible to arthritis in the knees and sometimes shoulders, lower back. That makes it harder to exercise. I see that as a major source of concern for many of my patients, is pain and pain limiting exercise. And we know that exercise is the most important measure that you can use to slow Parkinson's disease progression and improve your function overall. So maintaining a good, stable, average weight, so to speak, is a good way to make sure that you can move and maintain the energy balance that your body needs to fuel the increased demand from your Parkinson's disease. So moving on to reducing swallowing dysfunction and also enjoying mealtime. The first of these is usually emphasized by specialists in movement disorders. We should always be asking about swallowing dysfunction, coughing or choking during meals, eating or drinking, because that occurs as Parkinson's disease progresses with time. And different people will be affected by that differently. So seeing a speech and swallow therapist early on, even soon after your diagnosis, if you haven't had any problems with swallowing, can be helpful to establish a baseline, make sure that all of your physicians and clinicians know what your swallowing function is and what it's doing. And also provide you some proactive tips on things that you can do over time to make sure that you keep enjoying your meals. You're swallowing comfortably, you're eating at a good pace that's comfortable for you, and you enjoy eating. And this is the second point I wanted to make. In addition to avoiding those foods that really trigger dysphagia or difficulty swallowing, like dry foods, and making sure you're taking in water with meals so that it's easy to swallow. And then using softened foods if it's appropriate, or steamed foods to improving your swallowing. In addition to all of that, that the swallow therapist will speak to you about if you have access to them and you can see them, or your neurologist will as well. It's important to keep enjoying meals in general, because mealtime is a source of joy for many people, most people throughout their life. And as your sense of smell has been affected, possibly, and sense of taste has been affected, it's important to take measures to compensate for that. And if you're swallowing slowly and eating more slowly and becoming frustrated at meals, you're really losing a source of joy and time with family, or maybe just time to relax and think and enjoy your meal. So it's it can be a real problem for some people. And some people might even not realize that they're missing a source of joy in their life that used to, something that used to be very pleasurable for them. So that might mean just increasing the amount of flavoring spices in your meals. It might mean taking some dedicated time to sit at a table and appreciating that it might take you a little more time to eat, but enjoying that time with family. But I just encourage you not only to think about how you can swallow safely and what foods might allow you to do so, speaking to a swallow therapist, but also taking measures to keep enjoying your meals. So the third concept is constipation. And just again, give me 1 second here. I hope you can keep seeing the screen. I've lost my timer, so I'm just gonna move one of my windows here. Perfect. Okay, so constipation, important issue for many people with Parkinson's disease, and there are steps in your diet that you can take to reduce it. So why does constipation occur? Well, in Parkinson's disease, there is loss of brain cells, and there is damage to brain cells, specifically those producing dopamine. But the brain is not the only place where you have neurons or nerve cells in your body. There is this idea of an enteric nerve system, the second brain in the gut. And that signaling, there's my dog, that signaling pathway is disrupted by Parkinson's disease. And so the transit time, the time it takes food to get from one end to the other, increases. And that leads to more water absorption and constipation. So there are two ways to reduce constipation, or two sources of fiber, which is your main tool. One is soluble fiber, the other insoluble. So just so that you know the difference, I'd like to go over each of these. Soluble fiber is that which you can find in oats, in chia seeds and flax seeds, and in psyllium fiber supplements that you can get. That's basically what Metamucil is, but you can also find it as psyllium fiber. These will basically form gels. So there's molecules in all of these sources which attract water and hold on to the water and then form a gel. That gel forms in your gut and allows food to pass smoothly through the gut. The second form of, so I'll say quickly, soluble fiber requires that you maintain very good hydration, because as it forms this gel with water, if you don't have enough water, it can't form the gel. So if you're getting a lot of your fiber from soluble sources like oats or psyllium fiber, you do need to maintain good hydration throughout the day. The second source of fiber is insoluble fiber or roughage. Just think of this as anything that's difficult to chew. So vegetables, yes, usually have fiber, but there are some vegetables which are really easy to chew and process. For example, baby spinach, not a lot of fiber in baby spinach. So if you want to take in more fiber through vegetable sources, you want to think about things where you're really chewing for a long time, something like celery. very fibrous. That's gonna have much more fiber than something that's easy to chew, like salad greens. And then of course there's wheat bran, which is a great way to supplement fiber in your diet. So to move on, this idea of medication absorption, and this was one of the questions. One of the attendees was asking, was having difficulty with wearing off of medication. So that's a medication effect that is sustained for a few hours, but then drops off before the next dose of, say, levodopa is taken. So there's a period of time where symptoms of Parkinson's disease return, and the effect of the medication wears off. So diet can play a role in the effect of medications. Usually, though, this is later in the course of disease. So later in the progression of Parkinson's disease, maybe after 5 or 10 years, or sometimes longer, the body really needs consistent absorption of that medication in order for it to have an even effect, because the brain has lost its ability to buffer that chemical. As the cells in the brain that produce the dopamine are lost, our brains lose the ability to sort of buffer and reduce the fluctuations that occur from taking a medication 3 times a day. So that means the body has to absorb it really well. And in the gut, the way that levodopa is absorbed is through this transporter called the neutral amino acid transporter. Levodopa is itself an amino acid, or derived from an amino acid. And proteins are also comprised of amino acids. So if you have levodopa as one amino acid and proteins as another, and they're both trying to get through the same transporter, there can be competition. So again, later in the process, if you have fluctuations, you may find that taking in large amounts of protein interferes with the activity and action of your medication. The other thing that can do that is taking in really large, often high-fat meals at the same time as eating, because that can just simply delay the emptying of the stomach into the intestine where the levodopa or the medication can be absorbed. So those 2 factors, big meals and high amounts of protein, can both be important in medication absorption. And if you're at a period where you've had Parkinson's disease for 15 years and you have a lot of fluctuation already, you may be somebody that finds that taking in smaller meals and being very careful about protein intake makes the effect of the medication more consistent. And in particular, it's important if you are one of those people, and it may take some experimentation to determine if you are, to avoid protein intake 60 minutes before or after a medication dose. And that can be kind of difficult. You may not need the entire 60 minutes. And that may be very difficult if you're taking medications more than a few times a day. So that's why this is not a recommendation for everyone. It's really only a recommendation for people who have determined that, yes, protein absorption, it does affect, protein intake does affect my medication absorption. For those people, there is even a diet called the protein redistribution diet, where small amounts, very small amounts of protein are taken in for most of the day. And then most of the protein that your body needs is taken in the last meal of the day. The downside of this diet is that it's difficult to adhere to. People usually eat less on this diet, and so it does lead to weight loss. And if you think back a few minutes, weight loss is something really to be avoided in Parkinson's disease. We want to keep you at a really stable weight that allows you to move and exercise and get the needed movement that we know is effective and protective in Parkinson's disease. So I think one of the questions was, I'm having difficulty with wearing off. My physician suggested I chew a tablet of levodopa and then take some juice or water. So, and this wearing off, I think, was occurring when this person was thirsty or hungry. It may be in that case that this is not an issue with medication absorption, but rather just an issue with medication timing. And so it may be, in that case, more appropriate to just compress the timing of the medications. So go from, rather than taking every 4 hours, to every 3.5 or every 3. But I don't think in that circumstance that it's an issue of medication absorption, but rather just the medication timing. So then moving on to really the most important topic, what can we eat and what can we do to slow disease progression? Is this possible? Well, there's been two main categories of diets that people have thought about for this question. One is the ketogenic diet, and the other is the Mediterranean diet, or what's called the MIND diet. And so starting with the ketogenic diet, this is a diet where you encourage the body to produce ketones. These are the chemicals that are produced from fats that the brain can use for energy. And what that requires is restricting very heavily the amount of carbohydrate that you take in. So you're eating a lot of high fat foods and very little sugar. And to maintain a state of ketosis, where your body is producing ketones, really requires you not take in more than a few grams of carbohydrates throughout the day. So that's like a tablespoon of sugar, or a half an apple, really, really restrictive. So for the most part, I say that the ketogenic diet is just not a practical option for patients with Parkinson's disease. I think the downsides are high in promoting weight loss and restricting the amount of energy that your body has to fuel itself and facilitate movement and exercise. There may be benefits to the ketogenic diet for the brain, and certainly in patients with other neurologic conditions like seizures, the ketogenic diet can be great, but it's not the best diet for slowing and preventing progression of Parkinson's disease. The Mediterranean and MIND diets are related. So the MIND diet was created in 2014. It's a combination of something called the DASH diet, which is a diet you might have heard of to prevent high blood pressure, and the Mediterranean diet. Both diets, the Mediterranean and the MIND diet, focus on limiting meats, really encouraging intake of fish and poultry to some degree, encouraging intake of whole grains and high amounts of vegetables, fruits, and vegetable-based fats like olive oil and nuts. The Mediterranean diet is, I think of it as more of a holistic approach. So less oriented towards what specific foods to eat or avoid, less detail oriented, and more oriented to a kind of approach. So there's some vagary here. Mediterranean people don't all eat the same thing, but there is definitely a trend towards fish, olive oil, legumes, lots of vegetables and protein, lots of bright and fresh foods because of the availability in those countries, and lower amounts of processed foods, specifically lower amounts of animal fats, less fast food. The MIND diet, in comparison, really does take some of those concepts, but it adds in specific foods that are helpful to the brain. So these are foods with antioxidants and certain phenols that are beneficial to the brain, I believe, that you can find in blueberries and leafy green vegetables. It does encourage a little bit of wine intake because of the possible benefits of red wine, and specifically limits certain foods that may be harmful. There's not a lot of definitive research on this, but to this end of limiting harmful foods, it restricts butter, margarine, and cheese. So these are certain saturated or animal-based fats that are restricted in this diet. But again, they're very similar. And so there is a controversy about how and whether these diets are protective. It may be that the effect of these diets on Parkinson's disease is mediated by the protection against stroke and blood vessel disease. So it may be not a direct effect, but an indirect effect of really promoting good cardiovascular health. And we look at these diets and we think, as North Americans, oh, that's wonderful. These look like healthy, rich, whole foods. It's going to be more expensive, but it looks like this is at least what our culture is telling us that is superior. Actually, there's not a lot of evidence that that's the case. So if we want to be scientific about this and not intuitive, it's not totally clear that these diets are helpful yet, but they're definitely not harmful. And there has been a good amount of research to associate these diets with benefits of Parkinson's disease. So I want to draw a distinction between a cause relationship and an association relationship. And we can't really get at a strong cause without doing a randomized trial, a randomized clinical trial. But what we have done, or what the literature has shown so far, is that in many observational studies, looking at a big group of people and then seeing what their behaviors are, those people who have more of an adherence to these Mediterranean diets with whole grains, legumes, fish, olive oil, vegetable-based fats, tend to do better. They have later onset of their Parkinson's disease. They have a slower progression, a lower risk in general. Whether this is something about the diet or something else about the habits and tendencies of these people is not really known. The epidemiologists can try to control for things like sociodemographic status or education, activity levels, but it can be very difficult to eliminate those confounders, those things that tend to track together with adhering to a diet like this. And there is an ongoing study in Florida looking at the effect of this diet on digestive function. And then there have been a number of trials on this diet and memory, which have also shown a benefit. That was the original purpose of the diet. The MIND diet was in improving cognition and aging. And it seems like both the Mediterranean and MIND diets can be helpful in preserving cognition in normal aging and in Alzheimer's disease. I'm going to fly through this because I want to give enough time for questions. So it's not too important to understand the difference in the phases of these trials, but here is a landscape of all of the different clinical trials that are being done, all of the different compounds that are being tested for Parkinson's disease. It really is, it's wonderful. The top half of this circle is compounds that we hope might modify the progression of disease. And the bottom half are compounds that are reducing symptoms. So the circle, this is a phase 1, which is an early phase trial. This circle is phase 2, and this inner circle is phase 3. And I've highlighted just a few with that are related to diet and digestive function and energy and metabolism. So in the metabolism compound are medium chain triglycerides and ursodeoxycholic acid. So that's a long word, but this is a bile acid that was originally discovered in bears, hence the UCLA shout out to my training, my fellowship location. I'm at USC now, but I'm new to this area, so I don't buy in as much as I should to the rivalry. So there's a shout out to UCLA. In the antioxidant category is vitamin E. And in the gut and microbiome category, there is a trial of fecal transplant for Parkinson's disease. And these are pills that have been encapsulated, basically, that it can be given to somebody multiple times a day for a certain amount of time to test whether changing the amount in the microbiota, the flora of the gut, can be influential on Parkinson's disease. And it's too early to see if any of these are effective. But if they may be, how might you get these compounds and how might you integrate them into your diet? Well, medium chain triglycerides, which are being tested, can be found in coconut oil and in all different types of dairy. So if you take in those in small quantities in your diet, it may be beneficial. Vitamin E is found in vegetables, nuts, leafy greens, and probiotics and fermented foods. And where can you find all of these foods? Well, wonderfully in something like the Mediterranean diet, vegetable-based fats, nuts, legumes, leafy greens. Just add in a little bit of yogurt and you're there. So if you want to maybe get the benefits of most of these compounds that are being tested right now, you can just integrate some of the foods in the Mediterranean diet. And what about supplements? The first and most important, I think, is probiotics. These have been considered a lot in Parkinson's disease because of the known connections between the gut and the brain, especially for Parkinson's. There's been 2 randomized control trials of probiotics that have shown some benefit to movement and some benefit to gut function. So that's enough for me to say you should be taking in some probiotics. Don't go to the grocery store and get the pills necessarily, or to CVS, but just take in some fermented foods in your diet. Yogurt, kefir, sauerkraut, as you can find. But integrate that into your normal eating. Omega-3 and vitamin E is something that I often is one that people often have questions on. There have been few studies, only one moderate quality study which showed a little effect, but it's not harmful. And then in general, vitamins are not effective at changing or slowing the course of Parkinson's disease. Turmeric is one that people also have interest in, and there have been no convincing studies to show that turmeric has a benefit in slowing the course of disease or has any benefit on movement or motor function. Really few studies at all actually on turmeric, excuse me. But none of these things are harmful, and they all have good evidence in animal models and preclinical studies, scientific studies on cells, on animals, to show a potential benefit. So my suggestion is, if you're interested in incorporating turmeric into your diet, yes, you can go and get a turmeric or curcumin supplement at the drugstore. Are you really getting benefit from one compound? There's no definitive evidence that that's the case. And it may be other compounds that come along for the ride in diets that incorporate turmeric, like the South Indian subcontinent. So if you want to give yourself the best possible benefit from what you're eating, I suggest eating a little more holistically and incorporating recipes that use these spices. Just get a bottle of turmeric and start using it, and start cooking these kinds of recipes so that you can vary your diet and take in these extra players that may come along for the ride that we haven't figured out yet. But rather than trying to identify one compound and taking that in large quantities, thinking a little more broadly, I think appreciates the fact that we have very little certainty on the effect of these compounds, and also appreciates the bigger picture, which is that the suggestion that turmeric might be useful didn't come from people taking turmeric supplements. It came from looking at people who have diets that include turmeric. So incorporate those things into your diet, and I think you would be following the evidence. So those are the key takeaways. And I think I've emphasized these throughout the talk. But just again, make sure you eat enough in the right quantities that allows you to maintain a stable weight that allows you to exercise. Not too thin, not too heavy that you can't get out there and go for a walk every day. Eat a diet that's rich in fruits, vegetables, fish, fats from vegetables, berries, and think about the Mediterranean Mind diet as good choices. If you're having difficulty with timing of your medications, consider timing your meals around when you take your meds, and consider talking to your doctor about protein intake. And then make sure you take steps to continue enjoying your mealtime. Maybe that is incorporating new foods and new cuisines. Maybe it's taking more time at the table with your family. So how much time do we have here? Check again. Okay, 15 minutes. I think that we should treat the DBS portion of this talk as a Q&A, and I'm going to skip the history, and I'm just going to show you some pictures. So many of you have heard of deep brain stimulation, and I don't want to give short shrift to those of you who haven't, but I will talk about this again in the future, so at some point, so don't worry. But deep brain stimulation is a therapy that can be very effective in some people with Parkinson's disease for whom medications worked, but are no longer working well enough, either because of fluctuations wearing off, or because the medications are associated with excess movements or dyskinesias, which are painful or disabling to a patient. A deep brain stimulation system is comprised of three components. One is an implantable pulse generator or a battery in the chest, connected to a wire that runs under the skin, up the neck, barely visible over the scalp, to two electrodes, which you can see are implanted and stimulate using electricity areas that are deep in the brain. So you can see here as Parkinson's disease progresses, this blue area is the therapeutic window where you're comfortable, your movements are smooth and facilitated by medications. You don't have too much movement, which is up here in this dyskinesia territory. and you don't have too little, where you have slowness, stiffness, tremor. As the disease progresses, this window shortens and it becomes more difficult for medications to do the job on their own. So DBS, what it does is smooths out this, it smooths out the effect of medications. So it can reduce fluctuations and reduce dyskinesia over time. Just run through these very quickly. DBS is not a cure. Deep brain stimulation is not a cure. Deep brain stimulation can generally improve symptoms which respond to medications: tremor, stiffness, slowness, most prominently. The best that DBS can do is give you the best effect of your medications for more time throughout the day, so that you have more on time without dyskinesia, and really even out the effect of the medications. Tremor is an exception. Tremor can respond more to stimulation. So even if you have tremor, which is refractory or not sufficiently treated by medications, we can sometimes eliminate that tremor or dramatically improve it with deep brain stimulation. I'm going to skip this. There are two targets. I'm going to skip this. There is amazing advanced technology which stimulates in a directional fashion so that we can optimize the effect of stimulation without side effects, or with fewer side effects. There are 3 companies who are providing their devices throughout the Los Angeles area and throughout the world: Abbott, Boston Scientific, and Medtronic. They all have advantages and disadvantages, and each decision should be individualized, and will be, with your movement disorder specialist, based on your priorities, based on your symptoms, and based on your goals. This is my plug. I have a wonderful, I'm very lucky to be part of a wonderful team at USC, and here are their smiling faces. So come and see us if you're in any need, not just for deep brain stimulation, but the movement disorders division at USC is long established and has great expertise. So it's been, I've spoken for too long, but let's take some questions.
No, it's great. Thank you so much, Dr. Mason. This was fantastic. I learned a lot, and excited to take it back to some of the support groups as well. We have one question here by Devi. Hi, I've had the DBS and I am in the middle of the programming process. I've been craving sugar more than ever have before. I usually feel sick afterwards. Should I stay away from the sugary desserts? Great question.
You know, it's hard to know why that is. Your question is not why is this happening though, so I'm gonna try not to get into theorizing on why that might be. If there was a sudden change, it may be, and depending on where the stimulation is, in your craving for sugar, if there was a sudden change, it may be related to the stimulation. It may be related to medication changes that have been recently made. It may be because your body is still healing from surgery. I'm not sure how long it's been. Yeah, you don't need a medical degree to answer this question, but I would stay away from the sugary foods. There's better ways to get your calories, and sugar does provide you a quick reward signal, which all of us are sensitive to, but you may be especially sensitive to because of medications or stimulation. So it's good if you see yourself going down that road, do pare back.
Okay, thank you. This is from Vincent. Is there a sublingual carbidopa levodopa, I think that's what he meant, available for quicker absorption?
Yeah, that medicine is called Parcopa. It is an oral dissolving tablet of levodopa. It's the exact same thing that's in Cinemet. It's just it dissolves in the mouth.
Great.
It improves absorption a little, probably by 5, maybe 10 minutes. If you're having problems with medication absorption and wearing off, there are a lot of different options to talk to your movement disorder specialist about. There's Inbrija, for example, which is an inhaled form of levodopa, or there's simply changing the amount or schedule of the medications that you take.
Great. All right, here's one. This is from Jay. Is it true that too much turmeric will change your skin color?
I don't know. And I promise you, I have no idea.
Yeah, I haven't heard that.
I will.
Okay.
That's an interesting. I will never try to. Yeah, have faith. If I don't know something, I'm going to tell you. That's one I
I
don't know.
know it'll stain your hands for sure.
Yeah,
Okay.
and anything it gets on, yeah, it's true. It's true.
Okay. From Brenda, my husband is a chocoholic and loves chocolate ice cream. Can you suggest a better alternative that may satisfy this craving?
This goes back to, I think, my first disclosure. This is a better question for a nutritionist, I think, than me. What is he getting out of this chocolate? I think is the question. There's a lot of different compounds in chocolate which do have different effects. There's a little bit of caffeine. There are, I think, what is it? An alkylated hydrocarbon which can protect against cough. So again, I don't know the answer to this question, but it depends what benefit he's getting. And I would, if you have questions like this, go to a dietitian or a nutritionist. That's what they're for, and they're available for you, and they're great resources.
Thank you. Okay, this is from Larry. What is a good substitute for butter?
There's a debate about this. If you're just trying to get calories, I think I went over, the vegetable oils. If you're trying to cook with it, butter has specific properties, and it emulsifies, a little better than a lot of fats. It has a strong flavor. So you can certainly get non-dairy substitutes for butter, which are from vegetable sources. And there's even vegan butters, which, do a pretty good job at substituting. You could think about.
Okay, thank you. I do want to put a quick note in here from Sarah that we will email everyone a link to Dr. Mason's previous presentation on DBS. It was very thorough. So we'll make sure you get that since he sort of condensed his presentation on DBS today. Okay, this is from Doris. Does brain stimulation work for stiffness?
It does very well. Depends on the kind of stiffness. As long as there has not been a contraction of the tendon around the muscle, sometimes the stiffness is so persistent and long-standing that the tendon which connects the bone and the muscle can shorten because of that joint being in a position for so long. If that's taken place, then the DBS won't improve the stiffness. In 95% of cases, though, DBS works exceptionally well for stiffness. It's one of the things it works best for.
Great. Okay, and now for Jay, has asked, what is the longest someone has lived with DBS surgery implants?
As long as I don't know the answer to your question, but Benabid, there was a team in France, in Grenoble, who was implanting deep brain stimulators in the late 80s. I'm not sure how many of those patients are still with us. There are patients with Parkinson's disease who I have seen who have had DBS for as much as 2 decades, and still have persistent benefit from the DBS.
Okay, wonderful.
There's no data to suggest that the effect wears off.
Okay, thank you. We did get a direct message. Is coffee good for Parkinson's patients?
It is. It in moderate quantities may be protective. And in fact, there was a medication which came out of research on coffee consumption and Parkinson's disease called istradefylline, or Nurians, as some of you maybe even have heard of. So take in small amounts of coffee. The downside is if you take in too much, or really any caffeine, you will, and tremor is a big issue for you. You'll see that your tremor will probably be worse.
Okay. Here's one from David. Does DBS have any effect on PD progression? If not, then does this dictate adjustments in the DBS stimulation?
Yes, yes, it does dictate. No, DBS does not have any effect on disease progression, to be clear. So implanting a DBS stimulator has no effect on the underlying progression of the disease. It does minimize symptoms, and as symptoms change over time, we do change the programming as frequently as necessary to adjust to those evolving symptoms.
Okay, and then here's one. How does sleep DBS compare to the awake DBS? Sleep DBS is very helpful for PD patients who cannot be off medications for a long time as needed for sleep DBS. So there's sort of a question and a comment here.
Yeah, and so it's a partial answer. So at US, here's another plug. USC, we're proud to be the only center in Southern California that offers a sleep DBS, and our surgeon Brian Lee was trained up at UCSF in what's called a ClearPoint technology, uses MRI guided DBS implantation. So rather than needing to be awake for a portion of the surgery in which we conduct physical testing, the MRI entirely guides the placement of those electrodes in the brain. And so the patient can stay asleep for the duration of the surgery. That keeps people comfortable. And if they have a lot of fear of the procedure, that can be helpful.
Okay, we have a couple little questions, and then I'd like to open it up. If someone cannot type into the chat, we'd like to have you unmute yourself and ask your question. But we have one here. What are best vegetable oils? If you could just, I know you've said that in the presentation, but you might want to touch on base on it again.
Well, so the Mediterranean diet does feature a lot of olive oil. Olive oil is a polyunsaturated fatty acid, has many polyunsaturated fatty acids. So I'm not sure there is a best for overall health, but any vegetable oil is better than lots of animal-based fats.
Okay.
And I see the last one, will DBS eliminate freezing? Rarely. If freezing responds to medications, if it clearly gets better when you're on your medications relative to when you're off or when your medications have worn off, then the DBS is more likely to help.
Okay. There's one last one here, and I think this is kind of an interesting one. Regarding red wine, does cooking with it eliminate benefits, and is grape juice a good alternative?
I don't know. I don't know the answer to that question. I'm sorry. Another good one for the dietitian.
Okay, great. All right, is there anyone that would like to ask a question by unmuting yourself and asking one verbally?
Yes, I do.
Okay.
You just said that the freezing is helped by DBS, or it doesn't.
I'm happy to clarify that. DBS in general helps symptoms that are also helped by medications. So if you're somebody who has freezing and finds that when you take your medication, there is a clear and consistent improvement in the freezing, then it's likely that the DBS will maintain that improvement for a longer time throughout the day. The DBS will, so to speak, help the freezing. In more patients than not, the freezing doesn't respond very well to medications. And unfortunately, we're trying our best to solve this problem through research. Unfortunately, in those patients that don't have benefit on their freezing from medications, DBS is unlikely to help as well.
Okay. So,
thank you again, Dr. Mason. And thank you to everyone for joining us for an online event from PCLA and Abbott. Please join us later this month for a two-part series exploring mind-body wellness. And wait a minute, sorry about that. I just lost my note here. From Sarah, I just lost the last video here. Okay, so we have a two-part series coming up on mind-body wellness. Thank you so much. Roadmaps to Better Living with Patrick Lasasso and physical therapist Z. Alzeg. We appreciate you joining us for this wonderful presentation. I learned so much and thought it was very, very interesting. I hope you all enjoyed it. Please register at PCLA.org if you would like to join any of our other events. And also, if you really enjoyed this event and you like having free events, PCLA would appreciate any kind of donations that you would be willing to make to Parkinson's Community LA at PCLA.org. If you have questions, reach out at info@PCLA.org and 310-880-3143. You'll be speaking with Sarah King, our information and referral specialist. And I do want to thank Abbott, our sponsors for this event today. And it was made possible by Abbott, and you can go on and get more information about Abbott DBS at www.abbottdbs.com. Thank you so much, and this was great. I really enjoyed it. And thank you all
Thank you,
for
everyone.
joining us.
Thank
you, Dr. Mason.
you.
Thank you.
Bye-bye, everyone.
Well, everybody.
Bye.